By staff. After the presentation, the general public will be given an opportunity to speak. Each participant will be provided 5 minutes in which to provide their comments or ask their questions. We will start with members of the public in the room. I don't believe we have anyone. Did you say there's no one on WebEx, or do we have people on? Okay, so Councillor Bob, if he has questions, we'll go to him. Council members will then be allowed to ask questions of clarity, remembering not to give their opinion on the projects, as they are to remain neutral until the process is complete. I guess I'm looking out. I don't know how much conflict will be here this evening, but while a member of the public is speaking, we're just asked to show respect and decorum for all participants. Refrain from unmuting their devices unless you're asked to speak. And when asked to speak, please make sure you speak clearly so participants can hear your comments. If you do come to the mic to speak, we ask you also introduce yourself and just what municipality you're from. So with that, I'd like to offer my thanks to the many residents that are joining us tonight and to those who will provide feedback and ask questions after the presentation. I'll now give the mic back to Mayor Brown to call our meeting to order.
Thank you, Councillor MacLeod. I also want to recognize Councillor McCabe. We get more names coming to my head, but I do want to recognize the President of the University, Dr. Keith, who's here with us tonight. So good to see you, Dr. Keith. Okay, so the first presenter is for 210 Malpeque Road. Robert?
Good evening, members of council, your worship, and members of the public here tonight. So this is a public meeting being hosted for a request to change the zone and property designation for 210 Malpeque Road. So the first change would be to the official plan land use map to change it from comprehensive planning area, which is basically a development reserve holding zone, to industrial. And then the rezoning, which deals with the use of the land, would go from CDA, which is comprehensive development area, again, another holding zone, to light industrial, the M1 zone. This is to basically allow for the existing drilling business to continue to operate within an industrial zone, since that is the light use in which is permitted under, and then to allow for the subdivision of approximately 1.9 acres of that existing drilling business, and then have the residual almost 6 acres remain in the CDA and the holding zone and designation zone until a comprehensive development plan is submitted. So this is the property in question. It's outlined in the blue there. You can see the existing drilling site tucked away in the northwest corner of the subject property. And again, this property as one is in a development holding zone. So again, comprehensive development. And this kind of this proposal kind of shows the proposed subdivision, so outlined in red. So that's the existing 1.9 acre drilling business. The applicant is looking at constructing a detached warehouse for the existing drilling business, just along the southern western edge of that proposed lot, which is outlined in red. And so basically tonight's public meeting is to hear any commentary in regards to the change in the zone and the official plan designation for this portion of the property, which again resides the existing drilling business, and then to receive any feedback on that. And just for members of the public and for members of council to note, the residual area, which is the remainder area highlighted in blue, would remain as comprehensive development area, so just basically development reserve, until at the time the applicant can come in with a full comprehensive plan for the entire lot. Because that's one of the requirements in the zoning bylaw, is that anytime you develop a site, you have to come in with a comprehensive plan for the entire site. And so since the owner, and he is here tonight to take any questions you might have. Has no plans for the residual 5.9 acres. He just wants to subdivide the existing drilling business off in a 1.9 acre lot and then kind of continue his operations by constructing a detached accessory building along that southern boundary, that edge. This shows the site plan proposal. And so you can see the site that's kind of highlighted there is the proposed subdivision lot boundary. So that would what the new lot boundaries would look like. And as you can see directly to the southwest of the existing building, they have a proposed structure, accessory structure for that drilling business. So that's the proposal that's before council, members of the public. Again, this application also entails a subdivision, but for tonight's public meeting, it's really just to get any public commentary feedback on the proposed change to both the official plant designation and the zone of the property. And with that, I can take any questions. Thank you.
Thank you, Robert. And before we open the floor to comments or questions, just a few reminders that each speaker will be given 5 minutes. There is a timer here to speak. Since this is a public meeting, we ask that before speaking again, you give your name, your municipality, your representative of council, but your municipality would be good enough. And please use the mic in the room when providing your comments. And for those joining us via WebEx, we don't have to worry. And we open the floor up. Okay, while we're waiting, any questions, comments from members of council? No. Okay, Robert, thank you.
Thank you. And just for members of the council, just to know, the owner, John, he is here tonight, but he does have a presentation. He can use my slides if he wishes, but he can take any questions that members of the public or yourselves might have. Thanks.
No. Thank you, John, for being here. We'll just move on to the next application. And the next application is 550 University Avenue. And Mr. Forbes will present on behalf of the City of Charlottetown, followed by Derek Brennan and Jackie Podger. Thank you.
Thank you, Your Worship. The applicant in this case is the University of Prince Edward Island, who have made application to proceed to public consultation for a development concept plan to allow the School of Medicine to be constructed on their campus at 550 University Avenue. As council is aware, the comprehensive development area zone of the zoning bylaw requires that council approve the development concept plan for the site prior to approval of any new buildings or uses occurring on the site. And the approval process must be treated as if it were an amendment to the zoning bylaw and therefore requires notification to property owners and a public meeting. The CDA zone allows council to approve any use or mixes of uses allowed in any of the zones of the zoning bylaw, including innovative mixed-use developments subject to a development concept plan and a development agreement. So in this case, the university is proposing the School of Medicine for on the UPEI campus, which is located on the north campus behind Alumni Hall. And this portion of the campus is currently vacant and consists of a meadow and tree cover. The location of the north campus is generally bounded by the north by C3 zoning, the shopping center commercial zone, and the Charlottetown Mall, and to the east by the Confederation Trail, the CDA zone, and to the south by the CDA zone lands owned by UPEI, and to the west by some more C2 highway commercial lands. So this evening, the university, Jackie Podger, will introduce their architect, and he'll go over the project in much more detail. And with that, I will hand it over to Jackie Podger to introduce the architect on this project. Thank you, Your Worship.
Thank you, Alex, Your Worship. councillors. So I'd like to introduce Derek Brennan from A4 Architects from Moncton, New Brunswick. Derek has been the primary architect for us. He also was the primary architect for the residence that we're just completing. And so he's going to take us through the siting as well as the floor plans for the building. So I will give it over to Derek.
Thank you, Jackie. I'll start off with a site plan. Like mentioned, this is the North Campus, so it's the first building on the North Campus. It's the one with the medical school building written on it there. Future buildings just gives an indication of potential future development. There's no plan for any of those right now, so it's just indicating that this is kind of the first step of a long-term plan for them. So University Avenue's on the left, the Confederation Trail's on the right. It's kind of a bit of a loop road that's existing coming across here. This is the existing one that's there right now that leads off from University into main campus. So the building is located kind of just off the corner, and we're going to extend that road up into the North Campus, just kind of in behind Alumni Hall, and to parking in the back areas there. So the entrances to the building, we've got one on the bottom of the page near the first road that's on the level 1. And because of the sloped site, there's an entrance at the back at the park, or the other side at the parking area up on level 2. So into the floor plans, this is level 1. At the bottom here, you can see the entrance in the middle of the building. And there's a corridor that connects up through the building that'll meet on the second floor for the other entrance. And that central corridor spine is carried through on all the floors. So it kind of divides the building into two sides on each side. We've got the different types of spaces here shown in different colors. So the green is labeled pre-clerkship. That's kind of the classroom teaching area on the right-hand side, which there's 2 larger classrooms, one for about 80 students and one for about 120. And then there's a computer lab there as well that can accommodate about 30 each when it's divided, or can be opened up to 60. And then on the left-hand side, behind kind of the core of the public washrooms and some services, is the anatomy area of the Faculty of Medicine. So there's a number of labs that are in there, embalming room, so there'll be cadavers in there that will be used to work on and learn and gain experience that way. And then a number of other teaching labs that are there as well. And on the right-hand side, also in the gray, is more just some service spaces, receiving, mechanical rooms, those sort of things. Up one floor at the top of that public corridor that cuts through the middle is the entrance from the parking lot side that opens up kind of all the way through the building. And then above the lower entrance at the end will be glass. Kind of on both ends of those actually will be glass and have that kind of animated spaces. So on the green here, again, you can see more pre-clerkship learning spaces. So there's 2 classrooms, oops, wrong one. 2 classrooms in the middle here for about 30 students each. And this being a joint faculty with Memorial University, the students in here will be taking the same classes as the students in Memorial. So there'll be 30 here and 80 there. So essentially a class of 110. So you could have a professor instructor here. You could have the instructor in Memorial as well. So there's a lot of technology and video links going into audiovisual going into these rooms to make sure that is all connected and everybody's getting the same teaching experience. With that comes a lot of AV support. So there's a AV office there that's staffed full-time with two people to look after all the whole building, essentially. And then off to the right-hand side, there's a couple of breakout smaller learning spaces. Just above that is the learning and wellness and success area. which is a bit of a resource area for students, whether they're looking for assistance with going through their finances or dealing with stress or mental health issues, those items. They can go see somebody, talk through something with them, counseling. And then on the other side, the large purple space is a medical clinic. So that'll be an active one for UPEI faculty, staff, and students and their families, as well as the public. It's quite a bit larger than just what is needed for the university. So that'll be open to a lot of the public. There's about 20 exam rooms in there, so there'll be a mix of nurse practitioners, physicians. More of a team approach is what the province is moving toward in that. And being located right in the facility, it's a good learning experience for the training doctors, but also for the nursing faculty on main campus that'll be utilizing this building a fair bit as well. Up one more floor, on the bottom right in the red, that is student spaces. So there's a student lounge that's in there with, there'll be seating area to unwind. There'll be a kitchenette for having your lunches, suppers or evenings if I suspect they're going to be there some long hours. Lockers for all the students, graduate study lounge. There's also a family room that's there if and it's open to faculty as well if they have small kids or whatever that they're looking for. There's a spiritual room. People can go and either by themselves or in small groups and have little sessions there. On the left-hand side is a couple more clinics in the brown. The larger portion is Psych D clinic. So it's part of the psychology program, which will be a active clinic for the community, but also a learning environment for the students there. And the darker brown on the bottom is ADHD clinic as well, which is tied into the medical clinic downstairs, Psych D, as well as the Faculty of Medicine. On the right-hand side, the orange, that's starting to get into the simulation area and the clinical learning. So this is set up, all the smaller rooms there are mock exam rooms. So the students will be going in there with standardized patients who are trained to either act like they have or go through the symptoms that they may have for certain conditions. And it'll be the students who'll be learning and learning to treat those and going through the process of understanding what they have. There's lots of corridors in this area because there's one corridor for the students. There's another corridor with windows, one-way windows for the staff and faculty to observe how the students are learning, how they're treating the patients. And that's the same way that Memorial Learns has theirs set up as well. So it seems to work very well for them there. Up one floor on level 4, this is all simulation floor. So there's a lot of simulation labs here set up more in a hospital setting, hospital rooms, different types of settings. So there's some of these will be used by the medical students. These spaces will also be used by nursing. They'll also be used by paramedicine, the community, so doctors and nurses who need to continue their education, different courses, different programs. There's going to be a lot of interdisciplinary studies and activities going on here. So there's going to be a lot of use in here. And each of the labs has a control room where they can set up because there's mannequins in them that they can activate and provide different conditions and different symptoms. Each room also has a separate breakout room or a debrief room where they can go afterwards where they're with their instructor, kind of recap the last hour or whatever they were going through the course or through the activity, that session. There's also a small space care kind of in the middle right here, set up as a couple of apartments. So like 1-bedroom apartments, bedroom, living room, kitchen, bathroom. So for the paramedicine is the main purpose for this, but also for nurses who might be going out on site. They'll have training to go in and into these smaller spaces where there's not a lot of room and actually get hands-on. And then it's also right next to the simulation labs, so they can come out of these spaces, take the patient on their stretcher down to the simulation room and go through that transfer procedure to the nurses and doctors who might be stationed at the hospital or other care spaces. The top four is, this is pretty well all faculty and staff. So on the left-hand side, the dark, or the top parts there is all offices for faculty, administration, different associate deans. On the bottom in the darker is a separate suite for the office of the dean. So there's the dean's office, meeting room, different support spaces in there. And then on the right-hand side is some larger meeting rooms, the main reception for the faculty. And the two large meeting rooms on the bottom here, there's a movable wall in there that can be opened up for larger functions if they have gatherings for graduations or for fundraisers, if they have donors, whatnot, coming in, which will also open up onto an occupied roof where they can come out if the weather permits. Might be a little cool on a day like today, but a couple weeks ago probably would have been all right. So that's mostly the inside, and then I'll go through a few of the renderings, the exteriors as well. So a bit of an aerial view kind of from the southwest. So University Avenue would be on the left-hand side, just off screen. The rest of main campus would be kind of on the bottom to the right where all of council is sitting. So you can see on the front part here, the entrance on level 1, more related to campus. Some open area in front of it here. We're going to develop that area, so it's a bit of a plaza. So students or staff can take a bit of a break, have their lunch outside, or just get some fresh air. There'll be a bit of different seating and that sort of thing. Just kind of a bit of informal gathering spaces there. A few pathways that kind of link back to main campus and then up towards the backside there as well. Most of the building is going to be brick, similar to what is on the rest of campus, with some large windows worked on some of the corners, some of the key corners you see here. And in behind those windows on the corners, we've put the more public spaces or the more active spaces. So the meeting rooms, the student lounges, the student study spaces, the faculty, different faculty spaces. So there's more animated and places where you'd be able to sit and kind of enjoy a bit more daylight and view out. This is from the same angle, but more of a street perspective. And as we drive up past the building towards the parking at the back, parking's on the left, and you can start to see the entrance on the level 2 and the glazing of that spine all the way up to kind of let some light all the way in through to the middle of the building there. We'll come around a little bit more of a square on view of the back part there in the entrance. This one here really picks up the straight on the entrance and the glazing that you can see through into that public corridor. Or there's a couple of these floors have a couple of rooms, more student study spaces or student lounges that are more open areas. And the last image is, so if you're coming from the road from main campus, this would be the view that you would have. Again, these larger spaces, the student commons on this floor, to more of the public classroom spaces on there. So that's a bit of an overview of the site planning and the interior floor layouts, and then some exteriors as well. So if anybody has any questions or thoughts or comments, thank you for your time.
Derek, we're going to open the floor up, but just to remind you, Derek was the architect for the student residence, correct, Derek?
Correct.
And this-
Yeah.
So what you see at Payson on University Avenue to the west is a design from his firm. So the mic is open. Please get up. Please come to the mic if you have any questions, comments. I can tell you it's a very exciting project. This is when you love to be on council, when you see a project like this come to planning and go to the next step, and that is the construction of it. Just introduce yourself, sir.
Hi, I'm Daniel Cousins, Ward 5, Charlottetown. Just out of curiosity, and this may be more of a curriculum side of it, but I'm noticing a lack of a surgical studio or surgical theater, more of.
Yeah, there's a surgical skills lab, simulation lab on the top floor, just for kind of minor, not on the top floor, on this floor. I believe it's this one here. It's not a surgical suite, surgical training, and that's really not part of the curriculum for this part of it. So that would be more hands-on in the hospitals, I believe. So there's not a facility for that training in this facility.
So we don't have
And that's tied in with the memorial curriculum as well. They have the luxury of being physically attached to the hospital, so they have access to some more of those spaces, but it's really not part of their main curriculum. It's more of the specialties that would be there.
So follow up to this based on UPI building their lovely new residence. And I love the design of this building, by the way. It looks very hospital-y to me. With a projected possible 110 students per year added to this four-year program, that's almost another 500 students that we'd have to house. Will UPEI be looking into expanding more residents, or how are we going to adjust the housing situation? Because I really believe we should be housing doctors on Prince Edward Island if we wish to keep them here.
Yeah, thanks. The 110 students, that would be 80 that's in Newfoundland at Memorial and 30 here each year. So it's the class, yes, is 110, but only 30 of them are at UPEI.
Yeah.
So the residents, it's not really part of this, the scope of this project right now. So I'm not really going to comment too much on that. It's more of a UPEI question for another space.
That's a Jackie question. So please get up. We're waiting for comments, questions. Okay, so we do have one counselor ready there, Derek.
Yep.
Counselor Tweel.
Thank you. Thank you for your presentation. When news was announced that the university was entertaining the thought of conducting UPEI Faculty of Medicine, there's a lot of excitement. And, if you look at the site plan, the building itself, the proposed building, you go back to the engineering building, there was a lot of excitement around that too. And I'm given to understand that that building could have been built a lot bigger. Does this building here that you're proposing allow for further expansion?
Year one, when they start, they're going to be planning on 20 students per year, with the longer term plan of having 30 students. So when we started from day one, we went as a starting point of 30 students in this facility for each year. So we've kind of built that in the short term expansion version of it. And there is a lot of interdisciplinary allowable space in here as well, which will be used for sure at the start of it. So on those couple portions. It's kind of to that extent is how much the future's kind of been thought of. And there's also it's up on North Campus as well. So there's lots of space for additional facilities or buildings up there. So it's more on kind of the future is more of the North Campus portion of it as opposed to a single building portion.
So there's plenty of opportunities and options,
Correct.
much like the vet college, for example.
Yeah.
You know, how that's evolved and expanded over the years. So this site plan will allow for that, you know, for the medical school, to look down the road at different amenities, different features, different possibilities. I say that because the University of Cape Breton, they're also entertaining a medical school as well.
Mhm.
And I hope that the university, and I'm sure a lot of thought has been put into this, but positions itself well, and so that we'll be able to not only be comparable, we'll be able to compete. And when we're looking to attract students as well as Islanders, that all of those possibilities are being taken into consideration. Again, this is a very exciting project. The support in the community is overwhelming. So I just want you to know that I'm very excited about it. So sooner we get started, the better.
Yeah, yeah. Thank you for your comments. Yeah, we looked at a number of sites on campus, 4 or 5 different ones, and this one of the things that was intriguing about this one was the rest of North Campus having potential for expansion up there as well. So,
But just one other question, if you don't mind.
yeah,
If you look at the site plan, and I see some walkways,
Mhm.
will this be the impetus or the incentive to connect with other walkways at the university, the natural progression to the rails and trails, and of course the proposed active transportation pathway on Towers Road? If you look at the, you know, if you take a snapshot of what the possibilities are,
Mhm.
we have a lot of students that commute down Towers Road. We don't have the appropriate venue for them yet, but it's something we're working on. And a lot of the students will come down Towers Road, connect to the rails and trails, and walk to the university. So I see this as, you know, as a bigger picture in terms of walkways for pedestrian traffic, cyclists, runners, joggers, and most important of all, people with mobility issues. So again, I hope we can tie all this in together.
Yeah.
I think it's a very exciting time.
Yeah. The whole North Campus plans haven't been figured out yet, but the green dashed lines we see on here are indications of potential locations for pathways. So connecting to University Avenue, where there's a crosswalk here, connecting to down to main campus, connecting through to the trail on the other side as well.
Thank you.
Thank you.
Thank you, Councillor Twill. Mr. Brennan, if I look at this plan, the plan looks great. It's, I remember speaking to Dr. Dickinson 3 years ago when my daughter graduated from Bachelor of Nursing, and he started to, you know, promote this. He's been promoted for a long time. So now we're seeing the real plan in front of us. But, you know, we do have the Institute of Climatology at the university. We have the Sustainability Engineering Program. The building, I think, the footprint is about 28,000 square feet.
Yes, that sounds about right. Yeah.
Yeah. And then if you add all the floors, you're up to about 140,000 square feet of workable space.
Correct.
How much is that going to be, like a net zero? Like, is there factors that are going to be put into this plan to, you know, support what your Institute for Climatology or climate change is doing in terms of promoting our community be more climate change resilient.
Yeah, we're going through those studies now. So that is on it is front of mind, kind of looking at those and seeing how efficient we can make the building and what types of systems are doing those. So we're going through those analysis, different systems and things now. So
Yeah.
Yeah.
And Jackie and I have had these discussions about, students are the first to get into a car to drive to the university. I did it for 6 years when I was at UPEI, but, we do have a transit system, so I'm sure there will be lots of accommodation for drop off, pickup for transit, and just the simple things like EV chargers and so forth.
yeah, that is what we're looking at. I don't think there's any buses on campus right now. All the way around the perimeter, I believe that there's, and so we're quite handy. I believe there's stops right on University, just off of that. So it's very handy, handy for that.
So the avenue is to the west, University, and then, as Councillor Tweed said, you run parallel to the Confederation Trail, which is the network that
which is here. That's
is a
trail
very,
there, so.
very functional trail, active transportation pathway for the city. Yeah, so it's all good. I'm very, very happy that I'm here tonight listening to this plan. It's a great plan. Thank you. Any other comments? Councillor McKay?
Yeah, I just want to say, I kind of ditto off everybody else, but the collaboration of service opportunity that's going to be provided through this building and the planning that's gone into it is really, really exciting for someone that works in this kind of area outside in a real world job. So I'm really impressed with it looks like the new model home health clinic's kind of going to be in there. You're going to have opportunity for kind of a one-stop place for our health services to come together, to be able to collaborate and really learn from each other and be able to provide great services for the residents of Prince Edward Island. So thank you.
You don't want to sum it up, Mr. President?
Thanks, Your Worship. Greg Keefe, I'm the interim president of the university. Thank you, Derek and Jackie, for your presentation this evening. We're here to answer any questions. I think there's been some very good points raised this evening around the energy efficiency and active transportation and so forth. And we will certainly take those back and make sure that we address those things. As was mentioned, the plan is there for this to grow. It starts with 20 students, moves potentially to 30 at some point. And just to clarify, medicine is a very integrated learning process, and so this is primarily the preclinical training and in the clinic setting, the clinical training. But there also will be medical students that will be across the province from tip to tip in medical offices, in hospitals across the province being trained. So this is one component of the training, the on-campus component, but there is aspects, and we're working with the health authority and the province on what will happen, for example, at the QEH or at PCH and so forth. So one component, a very big and important component, and I thank Derek again for all his hard work, but it's a big project. We're moving it forward. We're very excited about it. Thank you for your support.
Derek, I think that's it. Thank you very much. Thank you, Jackie. So, any new business? Motion to adjourn? Thank you very much, everybody. Have a great evening.